So, happy birthday, Obamacare! You know, since President Obama signed the ACA into law back in 2010, the gains we've made in making quality, comprehensive health care accessible to everyone have been nothing short of extraordinary. You know, thanks to the Affordable Care Act, an estimated 20 million people have gained health insurance, driving the uninsured rate nationally down to 10%. That is amazing. And besides that, that's the lowest it's ever been since we started having records. And that's pretty amazing. And here in Iowa, because we do care about Iowa, our uninsured rate had always been sort of low at 9.7%, but it is now down to 5%. That's pretty amazing. So give it a hand. Healthcare prices have risen the slowest rate in 50 years since the law was passed, and the success of the healthcare law goes far beyond really those numbers. Before the Affordable Care Act, you could be denied health insurance coverage simply because you had a pre-existing condition. And those didn't have to really be big conditions. And it's 129 million Americans with a pre-existing condition, including 1.3 million Iowans, are protected from coverage denials or reduced benefits. You know, before the Affordable Care Act, you could be subject to lifetime or annual lifetime benefits that were limited. And the coverage, meaning you were unlucky enough to get a serious illness or injury, getting sick could lead to bankruptcy. It could lead 105 million Americans, or nearly 1.2 million Americans, including nearly, that's the 1.2 million Americans, Iowans, benefit from these new protections. And that's amazing. As a doctor, we saw that a lot. And the last thing you need when you get a catastrophic illness is to hear that your insurance is going to be limited. And as a doctor, I have to tell you a little bit about preventive care. And as a doctor, you see nothing more important than preventive care. I hope you're all getting this, all right? Because if we keep someone healthy, if we catch illness early, before it becomes worse or more expensive, that's really what preventive care does. And because of the Affordable Care Act, 813,000 Iowans have been able to gain preventive service coverage with no cost sharing. These services include everything from cancer screenings to contraception, reproductive counseling, obesity screening, behavioral assessments for children, even flu shots and checkups. So I hope you're all getting this. All right? Yeah. All right. There you go. See? And that really has a lifelong effect. So that, an impact. So that as a doctor is really important to me. I can't overstate how important that is to remove those barriers so we keep Iowans healthy. But numbers don't tell the whole impact of the Affordable Care Act. They don't tell you about how important it is for Iowans to know that getting sick doesn't mean going bankrupt. They won't tell you about the freedom people now have to move, change jobs, and chase their dreams because they know they can still find health insurance outside of work. And they won't tell you about the woman I met in Cedar Rapids. And this is really important to me. She didn't have insurance, and so she had not gone to see a doctor. And she got, the Affordable Care Act, she got insurance. She had had a pre-existing condition, so she really couldn't before. She got insurance, she went to her doctor, and sure enough, she had cancer, a very treatable stage, and they treated it, and she's going to be really just fine. She probably has a 100% chance of being fine. And she wouldn't have had this gone on very much longer. And as a doctor, I can tell you, when you save a life, that's a big deal. Well, that's what the Affordable Care Act did, and that's what you guys put in. So happy birthday. It's really those type of stories that illustrate why we proudly celebrate the Affordable Care Act's 6th anniversary today. These stories are why Democrats have fought for decades to ensure that health care in America could be a right, not just a privilege. It's why we will continue to fight against any and all efforts from Republicans to bring us backwards. These stories are important to share, and that's why I'm honored to introduce Rick Smith of Des Moines, one of our great Democrats, who'd heard many of these stories when he volunteered to help sign Iowans up for health care coverage. Thank you, Rick.
Thanks for coming, and thanks to everyone else for coming. I know there's some folks here behind me that helped with enrollment as well as I did. So I'd like to just share a couple brief stories about the enrollment experiences I had, because I don't think we really understand how important insurance is until you're without it. I've always had employer insurance, so I never really realized until I helped with enrollments. what this means to families, what this means to people that have never had a doctor before. So let me share a couple of those stories. My first story is what I would call Grandma Knows Best. And I was doing an enrollment at Evelyn Davis Center. These were Saturday morning, we started at 9 a.m. And a couple folks showed up, and the lady introduced herself. She said, I'm a grandma, and this is my grandson. She introduced him. And she said, he doesn't have insurance, never had insurance, and he has a job where he doesn't have any insurance. She said, he thinks he's invincible. He thinks that he'll never get sick. But you know what? As his grandma, I made him come down here. She said, I went, woke him up, put him in the car, and brought him down because I wanted to sign up for insurance. And so after they were all done, they came back out, and I said, how'd it go? And she said, you know what? This gives me peace of mind to know that my grandson has insurance. So I asked him, and he said, yeah. He says, she's right. I should listen to her. So that's a Grandma Knows Best story. I love that. It was fun meeting him. The second story is about a young man that came in, and as I said, we started at 8 o'clock. 9 o'clock. He showed up at 8 o'clock in the morning. And he had told me that he had worked all night long. He was in a fast food restaurant, no insurance. And so I said, well, take a seat. It's going to be a wait because we don't start until 9 o'clock. And he sat down, and I noticed he fell asleep. And about 8:30, I noticed he jumps out of the chair and comes running up, and he said, did I miss it? Did I miss it? I said, no, you're fine. We haven't even started yet. And so then he told me, he said, my family, I grew up in a family where we could never afford insurance. We never had insurance. He said, I'm working in a fast food restaurant. I don't have insurance. I've never had a doctor before. And he said, well, I'd be able to have a doctor. And, you know, think about that. Never having a doctor. And he said, I always went to the emergency room or I just worked through it. I don't think some of us can realize how important this Obamacare has been to people like this. After he was done and got enrolled and came back out, I asked him, I said, how do you feel? And he said, I am so excited to have insurance. I'm so excited to find a doctor and have preventive care and get covered. So those are the kind of stories that I don't think we hear enough of. When you look at 20 million people, there's 20 million stories out there that I'd love to share with you. The final story is a personal story. It's about my own son. And my son graduated from college, got a good job, and was relatively happy, but his dream was to have his own business. And because, unfortunately, in college he had a pretty severe health crisis, he had actually infection in his heart, has heart damage. And so he was concerned that he left his employer-covered insurance. He would never be able to get insurance because of his pre-existing condition, or he would pay a fortune for it if he was able to get it. 2 years ago, he decided to act on that dream. He left his job, started his own business. He's on the exchange. He signed up 2 years ago. He re-signed up this year. Pre-existing conditions don't mean anything anymore. He got insurance, and he's got very reasonable cost insurance. I think sometimes we forget, we think just about people that never had insurance because of, for various reasons. But this is a case, my son's a perfect example of how people are no longer captive to employer-held insurance. He was able to demonstrate his entrepreneurial spirit. And by the way, he's very successful in his new business, so he's doing great. But we're really pleased. Those three examples, I think, tell you a little bit about why I'm excited about Obamacare, why I volunteered to help people sign up for Obamacare, and why 20 million people are living much better today with peace of mind and security because of Obamacare. So happy birthday, Obamacare. I love it.
Correct. There's nothing like the stories, right? So thank you so much. And now I'd like to introduce Bob Maida of Des Moines, who will share with us his personal health care story and why the ACA is so important. There you're coming. Okay, there you go.
Well, my name's Bob Maida, and when I was born, I was diagnosed with a congenital heart defect decades ago. And so I spent the first 30 days in an incubator in the hospital in Columbus, Ohio. I didn't think I would live, but I survived, and I had experimental surgery at Yale New Haven Hospital when I was 14, and I thought I was all done, but it turns out I needed more, so I had another done when I was 16. And I was doing fine, came out here to Iowa to go to college, graduated And after a number of years, probably 1984, I was working here in Moines. I was riding my bike to work on the way to Burley Mall, the Vietnam Veterans Leadership Program, and a girl with her license 2 weeks, racing back to high school, went around 2 cars and ran a red light and broadside at 40 miles an hour on my bicycle. They had to cuff them out of the car with the jaws of life. I survived, but we got a substantial thing from that paid medical bills at the time. But in the ensuing years, since 1984, I have probably had 8 surgeries, and last one, I've had 4 surgeries on my neck, and at one point, I couldn't pick up a piece of paper with this hand, my leg was dragging. They finally got me to Iowa City, and I only had Iowa Cares at the time, and they were going to put it off 6 months, and thanks to my wife Kathy, who doggedly went after them, and my neurologist, who happened to be friends with Matt Howard, chief of neurology, they got me in and said, well, we got a 50-50, you can either be dead or paralyzed or be fine. Luckily, I came out on the good side and I been fine. But the problem with people that don't have this, and obviously my pre-existing condition from birth, I would have been unavailable to go get private insurance. And there's so many people in this situation now before the Affordable Care Act. And then with the approach on better prevention, people that, like Rick was just talking about, who've never gone to a doctor, they can go get help and see somebody and get preventive care before they come down with something that is going to be really expensive over the long run, and that they were unaware of. So the Affordable Care Act has done wonderful things for our healthcare system. We've been great on outcomes over the last 80 years, but our insurance situation hasn't been, preventive care doesn't get covered. And with this change in the Affordable Care Act, people can get taken care of before things become a major issue. And so I think that's going to be one of the huge cost savings over the next 50 years, is people getting treated before they come down with some horrendous disease. So that's why I'm all supportive of the Affordable Care Act, and thanks.
Thank you, Bob. And now, thank you, Bob, and I'd like to introduce Lisa Vedder from Red Oak, who will talk about how the ACA has personally impacted her life. There you are, Lisa.
Hi.
There you go.
Well, good afternoon, everybody. My name is Lisa Vedder, and I'm from Red Oak, Iowa, and I too have a personal story to share. And I don't call the Patient Protection and Affordable Care Act Obamacare. And the reason why I don't is because I like the fact that the first 2 words are patient protection. And that is exactly what I have experienced in my life. I am a cancer girl. I have lived in cancer land. I had lost my insurance. Well, actually a couple of times I've lost my insurance. But the latest was in December 31st, 2013. And the only reason why I was able to purchase insurance is because of the Patient Protection and Affordable Care Act. My husband is a farmer. We are self-employed. I am also self-employed. I am a freelance writer and a marketing consultant. And so this has allowed us to continue to do what we do best for our family. And I will also tell you that sometimes there's perception out there that anyone who has purchased insurance on the exchange is not paying for it completely out of pocket. And I'm here to tell you that no, we pay 100% of our premium. And yes, healthcare costs are high and they have continued to escalate. However, that is not a result of the Patient Protection and Affordable Care Act. That is a result of our rising healthcare costs and other issues that we have that we can fix. We can fix those things. So I really look forward to the next 6 years and seeing what happens in order to improve that which we now have. And the last thing that I will tell you is that, you know, I was a woman who grew up in cancer land. My father was diagnosed when I was 2 years old, and so we grew up knowing all about caps. We grew up all about knowing about if we ever lose our insurance, we'll never get insurance again with our father. And so it was very important to me, even at a young age. I knew I have to have health insurance and I have to keep the health insurance. And when we started having children, what happened was we had one daughter that had some health issues, and then all of a sudden we were stuck with the policy that we had, because no other insurance company would take us. So if you are an individual payer of your insurance plan back then, before the ACA, the premiums escalated like crazy. I can tell you that 30 years ago, we were paying $700 a month for health insurance. And so when I'm paying a similar amount now, I'm thinking, well, it costs what it costs. But I am so eternally grateful that not only can I be covered now, but other people like me can be covered. Because I do not want to rely on the taxpayers for my health care. And all it would take is one re-diagnosis of my breast cancer or another cancer that I had that was unrelated to breast cancer. All it would take is one diagnosis, and if I were trying to self-pay those medical bills, I would run out of money. And then I would be a person that would have to rely on all of you to pay my care. And I just want to say, no thank you. I am happy to pay for it myself. And I feel very blessed to do so. And I thank all of the people, even those that cross party lines to celebrate the Patient Protection and Affordable Care Act. Happy 6th birthday.
Thank you. I think that's the end of our speakers, so if you have any questions, I think we'd be glad to handle any of those. Or if you'd like to sing happy birthday.
For those of you who have obviously benefited from this, what do you think the reason is that we don't see public support higher since during these 6 years than we do? It's obviously still very politically charged and very mixed. Why do you think that is?
Can we come up here?
Personally, I think it's because people are associating our high health care costs with the Affordable Care Act, which is really a mistake, because even before the Affordable Care Act, before Obamacare, our health care prices were rising at tremendous rates. I would love to hear from somebody who knows what the statistics are now as far as what the increases have been in premiums.
Lowest increase in the last 50 years.
Lowest increase in the last 50 years.
Exactly.
I don't know that statistic,
That's
so
what
I'm really glad that you do. But that's why I think that there's a confusion, because they see those increases in their premium cost and they're like, see, it just keeps going up. But guess what?
It was going up.
It was going up before. And this is just the first step in trying to get control of these outrageous costs that we're all experiencing. This is the first step. And so I really look forward to, on the federal level, that them working with the policy that we have now, the law that we have now, and working to try to reduce some of those costs, and then maybe see some of those premiums go down. Thank you.
Lisa, can you slide down?
Yes.
When I was enrolling for the Affordable Care Act, it was in Adele at the library, and there was a woman probably in her late 50s. She came in a walker, and she was very tentative, asking questions. And I said, told her how to do it, and that I can direct her to, because I was not one of the persons that actually enrolled. I was just educating about the Affordable Care Act and directing the person. And she had lost her job the year before and clearly needed insurance. And she was so scared of the exchange getting on the internet, she wouldn't touch it. It was like it was going to come out and get her. The propaganda against it before it even was started was horrible. And so what I did was send her to an insurance agent who knew about how to do the enrollment instead of one of our people. And that's how scared she was. And she was very grateful to have insurance because she definitely needed it. And my personal story is that there was, my husband had cancer, and they were not, and I had lost my teaching job, was on, the COBRA, and they weren't paying, even though we were paying $1,135 a month insurance rate to COBRA, they weren't paying. And so I wrote to 12 elected officials and had 3 of them help me get it all straightened out. But it took 8 months for them to pay Mayo. And to the Affordable Care Act, people don't realize it, it has to be settled now within 2 weeks. Any dispute between the billing and the hospital, that is a big plus to those that already have insurance. And you don't know it, you need it until you need it.
Would you mind saying and spelling your name before you walk out?
Julie Stewart, S-T-E-W-A-R-T. J-U-L-I-E. J-U-L-I-E.
And did you say you're from Adel?
I'm actually from Waukee,
Waukee,
but I had gone to Adel, which is just 7 miles away.
Thanks.
Any more questions? Could I get your name as well?
Lisa Vetter, E-T-T-E-R.
Any other questions? Okay, thank you, everybody.
Thank you, guys.
Thank you.